Hi, my name is Andrea Aguilera. My topic about is Dapagliflozin and cardiovascular outcomes in type 2 diabetes. Definition. Dapagliflozin is effective for the reduction of levels of glycosylate hemoglobin, body weight, and blood pressures in patients with type 2 diabetes mellitus, mainly when added to other drugs like metformin. It should be considered as coadjuvant treatment. Also, it should be prescribed and on individual footing due to its cost and possible adverse effects. Dapagliflozin. In practice, clinical evidence, currently available clinical data for PDA in type 2 diabetes mellitus describe a versatile utility with good tolerability. Regarding the evaluation as monotherapy, in a meta-analysis by San, this drug was associated with a significant reduction in HbA1c, fasting glycemia, and CP, without increase in the risk of hypoglycemia, but with an increased risk of genitourinary infections.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Application in medicine. Dapagliflozin 10 milligrams once daily improves glycemic control and reduces body weight and systemic blood pressure when added to usual background therapy in patients with inadequately controlled T2D, pre-existing CVD, and hypertension. Pros and cons. Pros. The studies suggest that using both dapagliflozin and insulin has an advantage. Doctors measure values to see how well blood sugar levels are regulated over the longer term. This measurement shows the average blood sugar levels over the last few months. Cons. Side effects more likely to occur in older adults. Common side effects can include genital infection, urinate more than usual, or sore throat and runny or stuffy nose. Usually applied in Ecuador. Recently, the inhibitors of sodium glucose transporter type 2 used for the treatment of diabetes mellitus type 2 have demonstrated a cardiorenal protector effect. Experimental ECs and different studies have established that inhibitors of SGLT2 reduce the progression of hypertrophy, cardiomyopathy, fibrosis, cardiac remodeling, systolic dysfunction, and heart failure. In conclusions, dapagliflozin is effective for the reduction of level of glycosylate hemoglobin, body weight, and blood pressures in patients with type 2 diabetes mellitus, mainly when added to other drugs like metformin. It should be considered as a adjuvant treatment, although it should be prescribed on an individual footing due to its cost and possible effects adverse.
Hi friends, welcome to my channel for medicos. If you or anybody in your family is a diabetic patient, then information in this video will be helpful to you. This video will contains information on new group of oral medications SGLT2 inhibitors used for treating type 2 diabetes. Before starting, if you learn something or if you find information provided in this video as helpful, please motivate us by subscribing, liking and sharing this video. So let's start. Sodium glucose cotransporter 2, SGLT2, inhibitors, which are also known as gliflozins, are a new group of oral medications used for treating type 2 diabetes. The drugs work by helping the kidneys to lower blood glucose levels. SGLT2 inhibitors have been approved for use as a treatment for diabetes since 2013. They are taken once a day with or without food. Drugs in this class are, the following drugs belong to the SGLT2 inhibitors which are available in different trade names. 1. Dapagliflozin, 2. Canagliflozin and 3. Empagliflozin. How do SGLT2 inhibitors work? The kidneys work by filtering glucose out of the blood and then reabsorbing glucose back into the blood. The proteins that reabsorb glucose are called sodium glucose transport proteins. SGLT2 inhibitors block these proteins, which means less glucose gets reabsorbed back into the blood and gets passed out of the body via the urine. Hence, SGLT2 inhibitors work by preventing the kidneys from reabsorbing glucose back into the blood. This allows the kidneys to lower blood glucose levels and the excess glucose in the blood is removed from the body via urine. Who are SGLT2 inhibitors suitable for? SGLT2 inhibitors may be suitable for people with type 2 diabetes that have high blood glucose levels despite being on a medication regimen such as metformin and insulin. SGLT2 inhibitors are not recommended for prescribing to people with kidney disease, as kidney disease prevents the drug from working sufficiently well. What are the benefits of SGLT2 inhibitors? SGLT2 inhibitors help to remove glucose from the blood and therefore help to lower blood glucose levels and thereby decreases risk of complications of diabetes. By removing glucose from the body, SGLT2 inhibitors can also have benefits for weight loss. Side effects of SGLT2 inhibitors: as the drugs cause more glucose to be excreted in the urine, there is a higher chance of getting genital and urinary tract infections. These side effects are more common in women than in men. Taking SGLT2 inhibitors with insulin, sulfonylureas, or glycidides may increase the risk of hypoglycemia. SGLT2 inhibitors can, in rare cases, lead to a dangerous condition called diabetic ketoacidosis. Thank you for watching this video. Please subscribe.
Thank you.